Hi, my name is Jeremy Bordeaux. I'm a professor of dermatology at Case Western Reserve University, director of dermatologic surgery, director of multidisciplinary melanoma program, and director of our ACGME Mohs Micrographic Surgery and Reconstruction Fellowship. I'm here today with Jeff Scott, who's currently our Mohs Fellow and will be joining us on faculty in about 3 weeks. Not only has Jeff been our Mohs Fellow for the last year, but we were fortunate enough to have him as our dermatology resident and also served as our chief resident. What we'd like to do today is give you some background on our fellowship and just give you some insight into what we've been doing here. This fellowship started 3 years ago. Jeff's currently our third fellow. Our first fellow was Jennifer Dupri, who also was one of our residents, who went on to do the fellowship and is currently practicing out in Las Vegas. Our second fellow was Rachel Rodinez, who was from Vanderbilt in Nashville and currently is on staff and also has helped to train Jeff this year. Our other faculty members who take part in training include Dr. Margaret Mann and Dr. Jennifer Bonner. Our fellowship is quite competitive. Our last round of applications, we received close to 90 applications for one spot, so fortunately we have great talent to choose from. What sets our fellowship apart from many of the others in the country is our focus on advanced reconstruction, also our focus on learning how to do research and to publish our work, and also a focus on not just growing within dermatologic surgery, but growing within ourselves. So with that, I'd like to turn to Jeff and ask him what he's experienced and enjoyed throughout his year with us here.
There's so many things that I've enjoyed. It's honestly been probably the best year of my life, academically, for sure. I think what first comes to mind is the complexity of the reconstruction that we do. I can think of a handful to 10 cases that we've done this year that have never been done before in the world. So reconstructions that you've come up with, that we've executed, that no one else has ever tried or done or successfully completed. And I think that's really remarkable, and it kind of gives me inspiration and gives me the energy to come to work every day and have a great time. Working with you as my mentor this year has been awesome. And it's not only the mentorship that you provide in terms of clinical mentorship and research mentorship, but it's the sponsorship that you give, that you've given all your Mohs trainees and also the residents. You sponsor me to really allow me to achieve my potential. So one thing that you sponsored me in doing this year was being the fellow and training observer to the American College of Mohs Surgery Board of Directors, which was definitely a highlight of my year. I got to attend 2 Board of Directors meetings, hear from leaders in the field, see how they solve complex challenges in a large institution. It really was inspiring and kind of made me realize and made me see where I want to be down the line.
I appreciate those really kind words. I feel like I get as much, if not more, out of it than you and previous fellows. I have to say, like, when I first started, I would get very excited every day about particular reconstructions, and as time goes on, you see things over and over, and they're not as exciting as they used to be. And that sort of happens maybe once every couple months now. But now I get the joy of seeing you perform your first bilobe flap or your first cartilage graft, and that's been really exciting. What are some challenges that you've faced throughout the year?
Yeah, I think the biggest challenge that I didn't necessarily think about or experience as a resident here was the kind of the continued sense of stepping into the unknown as a Mohs fellow. So when you're doing reconstructions on your own, or even just taking layers, there's always things that you're doing for the first time, and at least once per week, maybe even once per day this year, I was put into stressful situations that I had to react to and work myself through and execute. And kind of by testing myself in these stressful situations, it allowed me to grow. And it was through these incremental steps that I really became comfortable doing Mohs surgery. but the kind of the stress in the day-to-day stress that these situations had was different than what I experienced as a resident, kind of learning clinical dermatology and seeing patients on a daily basis. It was a different type of stress that I hadn't experienced before.
Well, in addition to being in the learner role as a fellow, you also are in the teacher and mentor role with the residents. How has your experience been with our dermatology residents this year?
It's been great. Teaching the residents and being a part of their education has been definitely another major highlight of the year for me. I was a resident here, and I was a resident here at a time that there wasn't a Mohs fellow for 2 of my 3 years. And when Jennifer DePry was the fellow and I was a senior resident, I realized how awesome it was to have a fellow in your program. And as a fellow now, I realize how great it is to teach the residents and how much fulfillment and enjoyment that's given me. And I think the fellowship in general has really expanded and been just a huge positive influence on the residents. The residents have another teacher. They have someone they can run questions by. They have someone closer to their level of training they can seek advice from and learn from. And it's just been an overwhelmingly positive experience for them.
In what ways do you think the fellowship has prepared you for your career going forward?
Oh, in so many ways. I think from a teaching perspective, by having my own excision clinic once a week and teaching residents in that clinic and informally teaching the residents during your clinic, I feel like I've learned the necessary skills for teaching in a clinical setting as the Mohs fellow. And then in terms of clinical skills, the fellowship has prepared me perfectly for starting my own practice. I'm comfortable doing the basics of Mohs surgery, and more importantly though, I think I have the psychological skill set basically to adapt to stress and to see challenges as opportunities for growth. And when I do different types of reconstructions in my early career that I've never done before, I'll have the techniques and skills to do those confidently, even though I've never done them before, because of the teachings this year. And then kind of from a research perspective, your sponsorship and your mentorship to my early research career has kind of just put me in a perfect position to carry that energy and energy over into next year and the early stages of my career to continue in a strong research focus.
And what are some other experiences during your fellowship that you found to be quite helpful and useful?
Yeah, one that comes right to mind is my work with Dr. Margaret Mann on a weekly basis in her clinic. We have such a strong Mohs surgical department here and in reconstructive focus, and our training is top notch in that regard. And then it's incredible that the fellow also gets to spend time on a weekly basis with Dr. Mann, learning basically everything we would have to know to have a cosmetic practice and to have cosmetics be part of our practice. And it's just crazy to me how much I've learned from Dr. Mann, whether it be from her 10 lasers that she has to her expertise in neurotoxin injections or use of fillers, and then her vein work. There's not many fellowship programs in the country that would expose fellows to vein procedures, sclerotherapy and endovenous ablation. And the programs that do have that type of focus, there's just not the reconstructive focus. And to have a program that combines both of them and really allows the fellow to become proficient in both and really comfortable doing those vein procedures is truly an asset and truly a strength of this fellowship.
So we've talked about our exposure to more advanced reconstructive cases. We've also talked about the exposure to cosmetics that you get with Dr. Mann. Are there any other things that you think sets your experience apart here as a fellow as opposed to maybe other places?
Yeah, definitely the tumor board, the multidisciplinary tumor board that we have every week with medical oncologists, surgical oncologists, uh, radiation oncologists. That's been really also an inspiring and remarkable experience. There's so many rare tumors that we see on a weekly basis there, from advanced management of Merkel cell carcinoma to management of DFSP to management of other adnexal tumors. It's really, really interesting cases that we see on a weekly basis. And also we see a ton of melanomas. So what is it, like probably 30 melanomas come through each week. And what's great is we treat our melanomas both in situ lentigo malignans as well as lentigo malignant melanomas with Mohs surgery. So the fellow learns state-of-the-art techniques for Mohs for melanoma using MART1 immunostains. And it's kind of that, by doing that technique that's not widely done around the country, by learning that technique and doing Mohs for melanoma, it's really going to help me in my early career and throughout my career kind of stay up to date with evolving technologies and evolving procedures and really stay cutting edge. And I'm really fortunate and honored to be able to have that training be part of my year.